The common cold. We've all been there. It's that annoying runny nose, sore throat, and cough that seems to pop up at the worst times. But what exactly is it? The common cold is a viral infection. This means it's caused by a virus, not bacteria. These viruses love to hang out in our noses and throats, spreading easily through coughs and sneezes. There are actually over 200 different viruses that can cause a cold. This is why we can get colds over and over again, as our bodies build immunity to specific viruses. While annoying, most colds are not serious. They usually clear up on their own within 7 to 10 days. However, some symptoms can linger, like a cough, for a few weeks. The good news is that there are things we can do to feel better faster and prevent spreading our colds to others. Let's separate cold facts from fiction and learn about effective treatments. One of the biggest myths about colds is that antibiotics can cure them. Remember, antibiotics only work against bacteria, not viruses. Taking antibiotics for a cold won't help you get better and can even be harmful. Overuse of antibiotics contributes to antibiotic resistance, making it harder to treat bacterial infections in the future. Another common myth is that going out in the cold weather will give you a cold. It's true that we tend to get more colds in the winter, but this isn't because of the cold temperature itself. We're more likely to be indoors and in close contact with others during the winter, which helps viruses spread. You might have also heard that starving a fever will help you get better faster. This is another myth. When you're sick, your body needs extra energy to fight off the infection. Instead of starving yourself, focus on staying hydrated and eating nutritious foods. While there is no magic cure for the common cold, there are scientifically proven ways to support your body's natural healing process. One of the most important is rest. When you rest, your body can direct more energy toward fighting off the virus. Listen to your body and take it easy when you're feeling under the weather. Staying hydrated is equally important. Drinking plenty of fluids like water, broth, or herbal tea helps to thin mucus and prevent dehydration, which can worsen cold symptoms. Aim to drink fluids consistently throughout the day. Over-the-counter medications like pain relievers and decongestants can help to relieve symptoms like fever, aches, and congestion. Be sure to follow the instructions on the label and talk to your doctor or pharmacist if you have any questions or concerns. Section 4. Practical tips for relief. Beyond the scientifically backed treatments, there are some practical things you can do to find relief from cold symptoms. Using a humidifier or taking a hot shower can help to loosen mucus and ease congestion. Gargling with salt water can also soothe a sore throat. You might be surprised to learn that chicken soup actually has some science behind it. Chicken soup has been shown to have anti-inflammatory properties, which can help to reduce cold symptoms. Plus, it's a comforting and nourishing meal when you're not feeling your best. Another helpful tip is to avoid close contact with others to prevent spreading the virus. Wash your hands frequently with soap and water, especially after coughing or sneezing. If you need to cough or sneeze, do so into your elbow or a tissue rather than your hand. Section 5. Best practices for managing a cold. Managing a cold is all about supporting your body's natural defenses and finding relief from symptoms. Here's a recap of the best practices. Rest. Give your body the rest it needs to fight off the virus. Hydrate. Drink plenty of fluids to stay hydrated and thin mucus. Symptom relief. Use over-the-counter medications as needed to manage fever, aches, and congestion. Practical tips. Try a humidifier, saline gargles, and chicken soup for additional relief. Prevent spreading. Wash your hands frequently and cover coughs and sneezes to protect others. Remember, most colds clear up on their own within a week or so. If your symptoms are severe or last longer than 10 days, consult with your doctor to rule out any other conditions.